Hello, how are you?
I'm good. How are you doing?
I'm good.
I'm glad to hear it. I think they may have scared you with that ultrasound report. I reviewed it with one of the neuroradiologists today, and they feel like it's normal. They read it as a stenosis because of the velocity of the blood flow, not because of any morphologic abnormality of the blood vessel. And of course, when they did that MRI scan that day I sent you to the hospital, there's no evidence of stroke on that scan. So I think those both look okay, which is good news. It doesn't explain why you were having those symptoms that day. You said you had some funny sensation in the left arm and leg. So I can't explain that. How are you doing? Tell me what's going on with you. That was my update. Give me yours.
Literally just your paperwork.
Oh, okay.
But you just
I'm not sure what we need to do with paperwork, because I don't see any evidence of stroke on that MRI scan that would cause any trouble.
Okay, so why did Oye say that there was? Well, first we had the 2 EKGs that display stroke. Then I had
EKG cannot display stroke.
Okay, it just states it.
No EKG does that.
Okay, it just states it. It just states anterior ischemic on it, but it didn't mean anything?
It might suggest that you've had some ischemic injury to the heart.
Okay.
That has nothing to do with the brain.
Okay. So the 2 times that it said it, there were incidents afterwards.
Yeah, and that was on an EKG.
Right.
Has nothing to do with your brain.
Okay. But when it happened 3 days later.
When what happened?
When I had the loss of oxygen to my brain.
I don't know that that's true.
Okay, you didn't read the chart. You put it in your notes, so I'm like, why are we changing our mind?
Lots of people have chronic ischemic disease. It doesn't mean that you had loss of oxygen to your brain.
No, that's what I experienced.
Okay, if you say so.
Okay, that's what I say.
Okay. I don't know that I can document that or prove that, but you may believe that.
Okay, that's what I experienced.
Okay.
Okay. So where are we at now? So we're going to wait for cardiology to rerun the test?
I don't know. I don't have any. The cardiology tests are outside of my field. You'd have to review that with your primary care doctor or a cardiologist.
Okay.
If that's what you're referring to.
I mean, because right now you're saying the stenosis is not confirmable, but it was confirmed. So I'm like, okay, so now we're playing semantics? I mean, we're going against the diagnosis?
No.
I mean, did we not have a radiology team review it? I'm a little frustrated because
I'm really frustrated too.
Why are you frustrated?
Because this is frustrating.
Because I was sick for 3 months and Atrium played with my health?
No, ma'am. Because I already told you that I talked to a radiologist today, and they tell me that the reason, we talked about this I told you a few minutes ago, the reason they read it the way they did was because the velocity was high. But looking at the blood vessels, they don't look abnormal or stenotic.
Okay, so your team is going indifferent to the team that saw me for 2 days.
Yeah.
Is that what you're saying?
Yeah, it is.
Okay, so why were they not there?
Why
are they contradicting Atrium? I don't understand that at this point.
Well, the people I'm talking to are Atrium. So
so Atrium is being pit against Atrium?
Yeah, you could say that.
Okay.
That's all the time. You also had a CT angiogram that does a better job of looking at the blood vessels back, I think it was 2020 or 2021, and that one was read as normal.
Right, so that's why Vandercleef is confused at this point.
It would be almost impossible for you to go from a normal to more 50% stenosis in a few years. I've never heard of such a thing. But we could always repeat the study. We could repeat the CT angiogram and see how they look. That's something we could do. Or we could do another study, an MR angiogram. The truth is the CT angiogram is a little better. But I don't even know if it needs to be done.
Okay, so why are we doing this at this point? What's the difference between this and what I'm getting done on the 18th?
I don't know, what are you getting done on the 18th?
I'm getting a CT of my neck on the 18th.
Okay. A CT of the neck or a CT angiogram of the neck?
It would be my turn.
Yeah, I'm not sure. I'll look that up. So, as far as I can tell, there was no neurologic injury in February, which is good news.
Okay, but Atrium's playing with my health, which is bad news because I'm the one suffering. So I've been to the emergency room 8 times.
Yeah.
And my insurance has paid y'all $250,000, and I've been sticking in diapers for like a couple of weeks, and nobody's paying attention to that.
I'm sorry.
But yet, nobody realized that there was a crisis.
I'm sorry.
Hello?
I'm in room 2070.
The actress brought me to Belmont Hotel.
Oh, it's okay. You're good. Go ahead and go home.
You sure?
Yeah, go ahead. I'm good.
Is everything okay?
Yeah, I'm good.
Okay. I'm so sorry. Like, I'm so lost. I've been riding around. Like, where the hell am I supposed to be at? I'm so sorry.
It's okay. Thank you.
You're welcome.
Bye-bye.
All right.
Do you see my frustration?
I do.
That I've been to the hospital like 8 times in the last month and a half?
Yeah.
And nobody diagnosed anything, and then I have a hysterectomy that they say I didn't have, and then somebody puts under the impression of when 30 doctors actually said I had a hysterectomy?
Yeah, I don't know anything about that stuff. Of course, I had nothing to do with that.
Okay.
Yeah, it is frustrating. I agree. To see one study that says something's abnormal and another one says it's not.
But then your CT said I had mild degenerative disease, and then it said I have moderate to severe. So at this point, I don't believe any of your machinery.
Okay.
So your statement means nothing to me at this point.
Then why bother seeing me if my statement means nothing to you?
Because at this point, I just need my paperwork filled out.
And what's the paperwork about? Tell me about that.
It's the critical illness paperwork.
Okay. I'm not aware of you having any critical neurologic illness.
Okay.
So I can't fill out that paperwork.
That's fine. So you diagnosed it, but then you took it back, and then
I didn't diagnose anything, ma'am.
Okay.
I told you that based on your symptoms, I thought you should go to the hospital.
Okay.
And that was the last time you and I saw each other.
That was.
Before you went to the hospital.
That was.
So I had nothing to do with that.
So you gave me, you gave me
if
what
you let me finish.
Okay, go ahead.
I had nothing to do with that diagnosis or your treatment in the hospital.
Okay, so yet you sent me there for a diagnosis based on your findings, but you had none? So why did you send me to the hospital?
I sent you there based on your symptoms because you told me you had new numbness and tingling that started that day.
I told you that it started the day before.
No, you told me they started that
No,
day.
I explained it the day before because I had sent an email at 4:53 in the morning. And had you read that email, you would have known what I was talking about.
Okay. Email is not a way that we communicate with patients.
Okay, that's fine. But you have via chat, via Atrium. And I communicate via chat, via Atrium.
Well, if I got that wrong, I apologize.
Okay.
What would you like for me to do for you today?
At this point, nothing, because you said you can do nothing, so I appreciate you.
I don't see any evidence on that MRI scan of any stroke.
Okay. And you also don't see any evidence of the stenosis either, so we have that on record too?
It will be in my note today.
Okay, that works.
Yeah.
Okay, so we're good.
Okay.
Thank you.
You're welcome. Should we do an exam while you're here?
No, I'm good.
You sure?
I'm good.
It's what
my blood pressure's already up.
We would normally do it.
My tachycardia is already up. I'm out of the realm, and you're probably telling me that I'd be having a stroke at this point, and I'm just like, nope, I'm not going to go for it.
I just want to say that normally I would do a neurologic exam if you're here for a visit.
Okay.
But we can do whatever you prefer.
Okay.
What do you want?
I'm good. We can close this meeting, and I can go to cardiology.
Okay. Sounds good to me. I don't think you need to follow up here.
Me either. I'm good.
Very good. Well, good luck, my dear.
Thank you, sir.
You're welcome. All right. Come with me. I'll show you how to escape.
Take a moment. myself recording conversation. Thank you. Condescending son of a bitch. Condescending son of a bitch. But I got your bitch ass. I certainly did.